let's talk about something raw, real, and way too often whispered about behind closed doors: sex during pregnancy. Not the sugar-coated, just cuddle instead version, but the full, unfiltered truth, the toe-curling highs, the awkward moments, the unexpected changes, and the stuff that even doctors sometimes gloss over. Because here's the thing, pregnancy is a wild, transformative ride for your body, your emotions, and yes, your sex life. And whether you're someone who's suddenly craving it 5 times a day or recoiling at the thought of being touched, you deserve to know what's normal, what's not, and what could actually surprise you. First, let's shatter a myth right out of the gate. Pregnancy sex isn't just safe for most women, it can be amazing. A study published in the Journal of Sexual Medicine found that some women experience heightened arousal and even more intense orgasms during pregnancy, thanks to increased blood flow to the pelvic region. Think about it, your body is essentially in overdrive. Hormones are surging, and for some, that translates to a libido that's cranked up to 11. But here's the kicker, nobody warns you that this boost can hit hard in the second trimester. The nausea and exhaustion of the first trimester might have you feeling like a zombie, but once that passes, some women describe it as feeling like a teenager again, random bursts of desire, vivid dreams, and a sensitivity that makes every touch electric. But let's not pretend it's all fireworks and zero complications. Because here's the flip side, pregnancy sex can also be weird. Like, really weird. Take the logistics, for example. As your belly grows, positions that used to be effortless suddenly require the strategic planning of a military operation. Missionary? Might feel like you're being slowly crushed by a watermelon. Doggy style? Now with bonus lower back pressure. And let's not even get started on the sheer absurdity of trying to roll over in bed without groaning like a walrus. And then there's the noises. Oh, the noises. Between the creaking joints, the unexpected gas, thanks, relaxed muscles and shifting organs, and the fact that your body is now essentially a human incubator, sex can sometimes feel like a slapstick comedy. But here's the thing. Laughing about it is half the fun. The couples who lean into the absurdity, who don't take themselves too seriously, often find that pregnancy sex becomes its own unique, hilarious, and deeply intimate experience. Now, let's talk about the elephant in the room, fear. So many women, and their partners, worry that sex could hurt the baby. But unless you've been specifically advised otherwise by your doctor, here's the truth, your little one is oblivious. They're floating in a cushioned sack of amniotic fluid, blissfully unaware of anything happening outside the womb. The cervix is sealed with a mucus plug, yes, that's as gross as it sounds, and the baby is protected by layers of muscle and fluid. In fact, orgasms can even be good for pregnancy. The rush of endorphins can reduce stress, and the uterine contractions, which feel stronger during pregnancy, are just practice for labor. But of course, there are exceptions. If you have a high-risk pregnancy, placenta previa, or a history of preterm labor, your doctor might advise against it. Always check in with them, but for most women, sex is perfectly safe right up until delivery. Here's something else nobody prepares you for, the emotional roller coaster. 1 minute, you're feeling sexy and empowered by your changing body. The next, you're convinced you resemble a beached whale. Body image issues can flare up hard during pregnancy, and that's normal. A BMC Pregnancy and Childbirth study found that over 60% of women report feeling less attractive during pregnancy, especially in the 3rd trimester. And if your partner isn't initiating sex as much, it's easy to spiral into, do they even find me desirable anymore? But here's the reality, they might just be terrified of hurting you or the baby. Open communication is key. Say what you need. If you want reassurance, ask for it. If you're not in the mood but still want intimacy, suggest alternatives, naked cuddling, massages, even just lying together skin to skin. Sex doesn't have to be penetrative to be meaningful. And then there's the postpartum factor. Because here's the brutal truth, after baby arrives, sex might be the last thing on your mind, or your body's priority list. Between healing, hormones, and sheer exhaustion, many women don't feel remotely interested for months, or longer. A Journal of Sexual Medicine study found that 80% of women experience sexual dysfunction in the first year, postpartum. So if pregnancy sex is still on the table for you, enjoy it. Savor it. Because for many couples, it's the last hurrah before the sleepless nights and diaper changes take over. So here's the bottom line, pregnancy sex is messy, hilarious, unpredictable, and sometimes downright confusing. But it's also a chance to connect with your partner in a whole new way, to laugh at the absurdity, to navigate the changes together, and to celebrate what your body is capable of. Whether you're all in or totally over it, there's no right way to feel. Just know this. Whatever you're experiencing, you're not alone. And hey, if all else fails, there's always the trusty side lying position and a sense of humor.